My name is Ayodele. I am a cardiothoracic surgeon. I am primarily based abroad in the US. I've been a part of VOOM for 4 years now, since 2021. I've been a physician since 2013, so about 12 years. And I've been a cardiothoracic surgeon for about 4 years now. I joined VOOM about 4 years ago when I had a discussion with Dr. Kujo, who introduced me to the foundation, and I realized that it is a foundation that is very much in line with my goals as far as hoping to help build the healthcare in Nigeria. I got into medicine really from quite a young age because my younger sister was quite ill, and it took quite a lot of medical professionals and expertise to diagnose her and for her to get the proper care that was needed. And I knew from a very young age that I wanted to hopefully to contribute in that realm, to hopefully help other patients. My sister was quite ill from a young age, and she was actually one of the major reasons why my parents sought to move abroad to seek better medical care and to be able to actually have her diagnosed and treated. She eventually ended up having a double organ transplant in Kentucky and did quite well for many years. I think that it is very possible, and that is certainly the hope, that a place like Nigeria can improve sufficiently in the healthcare sector to be able to treat someone like my sister here, that she doesn't have to travel abroad. And that is, I think, that what everybody wants, to be able to diagnose patients here, treat patients here, and in order for that to happen, it requires the efforts of everyone, not just people here, but also people in diaspora. I think that most of us, either here in Nigeria or abroad, are really quite aware of the necessary improvements in the Nigerian healthcare system. There are multiple areas in which the Nigerian healthcare system can improve, both for the benefit of the healthcare providers, whether it be nurses or doctors or other medical professionals, but also improved for patients, primarily for patients. Fortunately, VOOM has afforded me the opportunity to be able to help as a surgeon on the ground here, to be able to help patients and also help with teaching other surgeons. I think it is so important to help in any way that we can. It is not necessary, I think, to be in the medical field even to make an impact. And there are multiple ways to make an impact, even with VOOM, outside of being a medical professional. I certainly understand the need to further oneself and assist my families, either by leaving the country or traveling abroad or getting work abroad. But I think it's also important to remember where we came from. I know that even though I've resided most of my life outside of Nigeria, I could not possibly be where I am without the direction of my parents and without the support of my family, many of whom still reside here in Nigeria. I think there are many aspects, there are many ways to be involved in building the healthcare infrastructure in Nigeria. It's not just through VOOM where one can be a part of the efforts being made here as far as being a medical professional, whether it's being a nurse or a doctor or a surgical tech or a nurse or a respiratory therapist. But one can also either donate money or donate time. There's much work that can be done either here in the country or abroad. And my hope is that people who are abroad can find ways to give of their time, their effort, donate of their money to help build up Nigeria, particularly in the healthcare sector.